Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, hello, Metro Detroit. This is Dr. Joseph Kanu, broadcasting live from Rochester Chiropractic Clinic, and we have Dr. Jeff in the house. Welcome, Jeff.
Thank you so much. How are you tonight?
Really good. Have I thrown you a curveball yet?
Not at all.
No.
But I'm always ready for it. I thought this was going to be a nice, easy, calm show. I mean, you're trying to.
Hey, that was 20 seconds ago.
I got to be on my toes, folks.
Yes.
But I'm ready. No,
Hey,
I'm glad to be here.
Yes, well, I am glad to have you back, Jeff. So you were at yet another seminar.
Well, seminar is I guess it's all semantics.
Well,
but seminar
this was beyond seminar.
It really was beyond seminar.
Yes.
It was more of a it was a 4-day course that actually had a live patient involved. So that definitely takes it up from a seminar where you're sitting there looking at slides.
In a classroom, looking
right.
at.
And so, no, I actually brought a patient out to the West Coast.
Oh, you brought somebody with you.
I did.
Wow.
There were certain parameters and that you had to, qualify for, and certain things that you needed your patient to, issues that they needed or had. And this particular patient who had been missing teeth in their back, upper back teeth for many, many years. And we've actually may have mentioned this on other shows in the past, but what happens is the sinus, we know what the sinus is. We breathe, everything that
right.
Up above.
Well, Michigan people know about sinuses.
They should, at least.
Right.
Unfortunately, we all do. Well, the actual sinus cavity is right above your upper teeth. Sometimes your upper teeth are actually within the sinus. Okay, it's that close
Wow.
of a proximity. And so, if you do lose a tooth or several teeth, what happens is that sinus, if it's already low, it's a problem. But a lot of times over time, it will lower even more. So,
wow.
Now you've got a sinus that's kind of in the way of ever really replacing a tooth. And again, we talked about how technology has changed. 10 years ago, these patients said, well, there's nothing you can do except for a denture, or a partial denture. Well, now there's procedures out there, which is exactly what I did on this gentleman last week, which is called a sinus lift procedure. And we literally...
Well, I've heard of a facelift.
This is
a sinus lift?
Facelifts. Sinus lifts aren't as sexy as a facelift,
yes,
unfortunately.
okay.
Facelifts, you're going to see a difference. You're going to like the end result. Sinus lifts are a little bit more behind the scenes, but literally we're getting the sinus cavity and we're moving it up. Doesn't cause any harm or constriction on any of your breathing or any of that. We're just kind of getting it out of the way so that we can build enough bone in that area so that we can place dental implants.
Wow.
Once you place dental implants, which are, for those of you who have not heard in the past I was talking about it, are actual titanium screws that go right up into the jaw, we can actually build full-on teeth and restore a person's mouth as God intended, originally. And
that is amazing that you're actually able to lift the sinus cavity. It's like you said in the old, even till I didn't know you did that even till now. That once the sinuses dropped, you did not have that option to replace, a tooth. You just had dentures.
You had really no choices.
And we've talked about how bad dentures are for your health,
right?
And the chewing ability.
Yeah, but you have no you can't get the nutritional value that I know that you and I hold dear to our hearts.
Right.
And really, it was an amazing thing. Because of what it accomplish for this patient. I mean, this
So
patient.
you actually did this is pretty major surgery.
Well, it is major.
way.
How about this? It's a major procedure, but I don't want listeners to sit there, fearful of it. Because to be honest, that patient walked right out of there. He was completely awake. The next day, I took him out for a very big dinner, which he deserved, of course. But I told him, I said, his name was Jeff also, coincidentally. I said, Jeff, if you're up for it, I think that you earned a dinner on the house here. Let me take you out. But if you're not up for it, let me know. He was feeling great. Don't get me wrong. He was very tender. He had pain medications that were keeping the pain level to a certain comfortable level. But this is the next day of surgery. So yes, it was major from a technique standpoint, and it's very involved. But from a patient standpoint, it's very doable. It was all done under local anesthetic, so just numbing.
I like that.
And
he was not under.
Not under at all. Patient walked right out of there, felt great, and it was.
Well, that's tremendous. I mean, I don't know. Not many dentists must be doing that surgery.
No, they aren't. There are a lot of people. Usually, a procedure like this falls into the realm of like an oral surgeon. But I think the kind of a misnomer is that general dentists just drill and fill. And really, that's not the case. A general dentist can do any of these procedures in this huge arena of dentistry. It just comes down to comfort level and, more importantly, expertise, meaning training. So if you're trained, I do all the root canals in my office. There are many dentists who don't do any root canals. Now, are there root canals that I refer to a specialist? Of course there are, because I know when to punt. I know when something's outside of my comfort level, outside of my realm of expertise, and if somebody can do it better than me, then I'm going to send them to see them. This is one of those procedures that, to be honest, I was doing it to see what my comfort level would be and to see if there's something that I would want to integrate into my practice.
Incorporate into your practice?
And, yeah, I mean, I had a lot of compliments on my instructors, and they pretty much said if you're not doing this when you get back to your practice, it's a disservice to your patients, because it did go very well. I was very comfortable doing it. It's all about managing your patient and knowing, the proper techniques and procedure, and it can help a lot of people. There are a lot of people out there that have been told that they'll never have teeth again, or that dentures are their only option, or they just have to put up with what they've been putting up with. So no, it was eye-opening. It was humbling, and it was a great experience.
That's
really
great, Jeff. Well, welcome back.
Thank you
to Detroit, and for all the listeners. This is Simple Truths for Healthy Living. You can go to our website, simpletruthforhealthyliving.com. All of Dr. Jeff's shows are posted there and all his information. If any of you would like to call in tonight or on this show, you can call 248-656-1011. Call 248-656-1011. Call our office, and Scott will put you right through. Jeff, why don't we start with a prayer? That was a good intro.
I'm glad that you remembered the prayer. I hope I didn't take you off task.
No, I mean, our show's at a half hour, and our intro's becoming 25 minutes long.
We need to talk to station. I think we really need a good hour from here on out.
Well, that's it for tonight, folks, and we'll see you next time. So, anyways. Let's read out of Matthew chapter 6, treasure in heaven. Do not store up for yourselves treasures on earth where moth and decay destroy and thieves break in and steal, but store up treasure in heaven where neither moths or decay destroys nor thieves can break in and steal. For where your treasure is, there also will be your heart. Now, I just thought that where moths and decay will destroy. I thought that would be good for you, being a dentist.
Decay.
You guys are always talking about decay.
It's a problem.
And not just teeth, but now we're talking bone.
It's true. That's true. It's really true. Luckily,
Jeff,
moths are not the root of it. But
and honest to God, I am so happy to hear that you're able to replace bone for people, not who had no other option. You're giving people other options.
Yeah,
that's really rewarding.
It is, and the fact of the matter is, and for those of you listening aren't familiar with this, if you lose a tooth, you start to lose bone in your jaw literally will deteriorate because there's no stimulation from that tooth. The brain, the body needs a stimulation of those ligaments around the tooth. Once the tooth is gone, that bone starts to shrink away and deteriorate.
If you don't use it, you lose it.
You got it.
Really?
Yeah,
right?
no question about it. And you lose several teeth, now we have a bigger problem. We start literally, I mean, your jaw will disintegrate. I mean, I know that all of us have thought about the grandmas and the grandpas out there that, their nose and their chin are touching each other. And I mean, everything's just kind of, shrunk away. And you think, oh, that's just because they're old. It's not. It comes down to taking care of what God gave you, which is your natural teeth. And if you do lose a tooth, it's kind of funny. I say, take care of what God gave you, and then other people say, well, you lose it, and you know what? Maybe this is what God intended for me. I don't believe it is. I mean, for you to just accept that.
No, we need to be good stewards of what he gave you.
Right.
If he gives you a car and you don't change the oil and take care of it and it breaks, well, God didn't intend that car to last more than a year.
Right.
Well, maybe he intended it to last. You just didn't take care of it properly.
Well,
maybe you need spark plugs or a new belt or a new this or a new that, right?
Right.
To keep it going.
Well, it's like that story that is one of my favorite stories of the person there's a big flood and he's on top of his house. And the helicopter comes and he says, come on. He's like, no. God will save me when he wants to save me. Then, another helicopter comes. God will save me. And then there's a boat that comes. God will save me. And then, unfortunately, that person dies. God, why didn't you save me? He's like, I sent you 2 helicopters, a boat. What do you want me to do here? So you have to look and you have to again we have
take
to be
an action.
Take some action, exactly. And so I always use the analogy of the bookshelf. I think it's a great analogy. People understand it. You take one book off a shelf of full of books. The 2 books on each side will cave in. Same thing with your teeth, and worse so when you lose several teeth. It becomes a big domino effect, and when you lose, especially back teeth, and unfortunately, this is human nature. Well, it's back tooth. Nobody's going to see that. No big deal. Then you lose a few teeth. I still got my front teeth. Well, front teeth were not built to chew. They weren't. They don't have the shape, the size, the strength to chew. You lose your back teeth, you'll destroy your front teeth. Things may look good. People may think you're fine, but that will bite you in the end. And so to have something restoring.
Well, that's a good way to put it. It's going to bite you in the end. But it doesn't bite you in
No, because they have no teeth, right?
Right. But then what you're saying, you're not chewing good, your health is an issue, and then other teeth start to fall, and then you get bone loss of the jaw. I mean, it's really a health issue.
It's a huge health issue. I mean, there are,
This almost goes back to your show last week where you talked about if they're just baby teeth, don't worry. Oh, they're rotten. No, don't worry. You don't have to brush because, why fix them? They're baby teeth.
You got it. I mean, hey.
That was a great show. I really enjoyed it.
It was good. I got a lot of response for that. It was great. And, well, again, we have to remember that the lay person really shouldn't know a lot of this. Some people, they're internet junkies and they know this stuff. I have patients who come in and I swear I think they know more about dentistry than me sometimes, But really the majority.
Isn't it great though?
It is good.
They're informed.
Very informed. And it's a good thing because they can ask the proper questions to make them comfortable in their decision. But the majority of people don't know this. I mean, the majority of dentists don't even pay attention to a lot of this stuff. So why would the layperson know? And so if something's not hurt, I mean, it's a classic statement of, it doesn't hurt me, doc. Let's not mess around with it. Why fix it? Well, here are the consequences. If we don't fix it, the A, B, or C could happen. Now, if I tell somebody that A, B, or C can happen, and they're like, that's fine, I'll take my chances, I've done my job. I've informed the patient. They know the consequences, and I've done my job.
They know their options.
Exactly, you know. But if I just take a tooth out, say, all right, thanks, Mr. Smith, see you later, and don't educate that patient on the negative consequences of that space, the fact that bone's going to deteriorate, the teeth are going to cave in, You're going to lose the back teeth support, which can throw off your whole bite, throw you into a jaw pain situation or a headache situation. Then I'm not doing my job. I'm not educating the way that I need to, And so,
and two, like you were saying, the back teeth. Hey, nobody sees them, but that really throws off your bite as well, right? So now we can get TMJ issues, headaches, wear out.
No question. I mean, if you had a,
I'm really getting understanding a little more the preciseness, if that's the right word, of your bite and how everything is supposed to fit. I mean, we're talking millimeters, right?
Even less than. You think about some of the works, some of the work that we've even done with you.
Right.
We're talking about 0.6 millimeters, 0.5 millimeters. That's like a hair,
Yes.
But it can throw the bite off enough where the muscles of your face react and can aggravate a person, And some people have very wide zones of comfort. Some people have low adaptive zones of comfort, right?
Yes,
so it depends on the person. Each person is treated individually and like a person in my office. I mean, it's not widgets in my office. Each person, I take their body into consideration and follow their body, let them guide me to what is right and what's wrong. I mean, we're talking about your dental work loosely, which I think that's going to be a show in the future.
Topic?
Yes, it is. But we talked a little bit about some of the dental work we've done.
Well, I'm going to tell you, Jeff, I'm really happy that my bite you've improved it to where I'm chewing salads and chewing my food better. I know it's still a work in progress.
It is.
But Dr. Jeff has it at his office, the K7 jaw tracker.
Right.
That really was a big help to understand and know what my bite was and where it was supposed to be.
Where it was maybe 20 years ago.
Where it was 20 years, and where it's just a slow diminishment.
Correct.
But that's a good point. It's like that in chiropractic too, where turn your head to the right, turn it to the left. And what people don't realize is slowly you start to lose your full range of motion. It creeps up on you.
Right.
The same with your bite, I guess, your teeth, right?
Sure.
Slowly, where you don't realize. So I really didn't realize that I wasn't chewing as good as masticating, digesting, and absorbing your food. As we get older, the hydrochloric acid in your stomach goes down if you're not eating raw food. But then just the whole chewing thing.
Yeah.
So the dentures.
Right.
I mean, that's if you're wearing dentures, now, and you've been told you have no choice.
Right.
What you're saying with this, I know this wasn't today's topic.
No.
We're supposed to cover, but that's pretty exciting.
It goes
that
hand in
people
hand.
who didn't have a choice if you're somebody who was told you have to wear dentures, that's your only options, Dr. Jeff might have an option for you.
Right. I mean, and for those of you who are listening and maybe some of this is you're sparking your interest a little bit. The first step is getting a 3D image of what is left, if you will, what your jaws have to work with. We have what's called a cone beam CT scanner. It's not like a medical grade, tons of radiation. We're talking fraction of the radiation that these other big machines do. This is a very, very different type of technology. Again, we've talked about it in the past. It not only is safe, but it gives us the data we need to see what you have, left over or what you have to work with, and B, what we need to do to get you to that level of maybe supporting your dentures, maybe with a couple dental implants or more. I mean, there's the options really, they are limitless. I mean, the sky is the limit with this stuff. But this is stuff that, again, and we have actually even mentioned this too. I'm very proud of my website. I've spent a lot of time on it. If any of this is, you need a little visual, I've got photos, I've got explanations about kind of the process of examining and diagnosing, your jaw, the proper bone quality and content with our cone beam, machine, and then what the options are of maybe placing some implants, maybe supporting your denture or more. You can go to our website. It's RochesterAdvancedDentistry.com. always, you can feel free to call our office at 248-656-2020. The ladies will bring you in for a consult, which is what we do every day for many people in the area, many listeners who come in, and even if they just want to kind of know what the situation is. I'm a very low pressure guy. I'm here to educate. If you decide, wow, this is something that I want to do, great. If it's something you don't want to do, you're not going to hurt my feelings, okay? I will still be your dentist. I'll take care of you. I will give you the information as you need it. And if and when you are ready to pursue something like this, at least you'll know what it entails. You'll know the procedure. You'll know the cost. All that. I don't like surprises. I want everybody to know where they stand. But it's very possible for people like that, Joe, who maybe are have kind of given up dental hope, if you will. They're
Sure.
living life.
Yeah.
You can live without teeth. You can live without teeth. I've said it a million times.
But
you
it
can do it.
shortens your life, and it diminishes the quality of your life.
It's not the way you want to live. You can live
Right.
without legs too.
Right.
But it's not the way that you want to live.
It's a great point. You can live without legs as well.
You can.
So, Jeff, I know you wanted to get into this topic of tonight.
I know. I don't think
Should
it's going
we
to
save
happen.
it next time?
Well, should we do? I mean, should we?
I think we should.
teaser. I don't know. I mean, there are a couple. Here's what I want to do.
Well, I have some mint here I picked this for you right out of my garden. I know you didn't listen to last night's show. We covered dandelions, which are now coming up, and mint.
No, these are not dandelions. These are mint.
This
right?
is mint.
All right, hold on. Let's see here.
Right?
I love my mint.
Do you?
The Arab in me loves my mint, and it gives me such fresh breath too.
Yes,
which is
isn't
good.
it amazing how tender that is? I mean, you could chew that with dentures right now.
Well, we just told people that wasn't a good thing, but yes, you're right. You could.
Yeah.
That is very good.
So mint is important.
So you have a
And
garden at your house, or
Yeah. I have a garden. I plant mint all around my house. Number one, it keeps away mice and rodents. Mint does. But it's so healthy for you and to boost your immune system. And this is what's growing right now. It's nice to stay in season to what's coming up. Dandelion, as we talked about, has just about every vitamin, every mineral known to man. It helps with everything.
Isn't that so? It's so odd to me. I mean, I'm sorry. I grew up thinking of the dandelion as a weed.
Yeah.
Like, it's amazing.
What are we thinking about?
Right. But, you and I were talking earlier about it, and you talk about the root structure system. I mean, trying to get a weed out is almost impossible. So
right.
It's got to be strong. I mean, for it to have that type of
well, it's getting a whole amalgam of nutrients out of the soil, too.
We don't like that word amalgam.
No.
Remember, we don't like amalgams. Amalgams in the mouth. We don't like that, right? I thought we don't like that. No, it is. It's amazing. I mean, that I actually am going to listen to your show from last night. I promise, because that is interesting.
Because mint has a little bit of an anesthesia effect on the teeth as well. I mean, not that you want to use it if your tooth is hurting, but if you use clove, peppermint, but there's 9 different chemicals in there that expectorate mucus and are good for your lungs. If you want to fight your allergies, dandelion and peppermint, that's your allergy shot right there.
No kidding.
At least you're eating something live that's homegrown.
Right.
But anyway, so we just have about 5 minutes, Jeff.
How did this fly by? So it just flies by when you're having fun.
I know it.
Or maybe it flies by because I just don't stop talking.
I know we were going to wait, but I really like that article you came up with.
Well, let me for those of you who don't know how I work, I like to prepare for these shows, and a lot of times I've got some ideas of my own. I'll base them on maybe procedures that I'm doing, a class that I just got back from, or even some patients that I've been working on.
I know I took you down the daisy trail.
The
we
old
got away
dandelion
from
trail.
what you prepared, and I want to tell all the listeners, Jeff put so much time and effort into the class. But I just thought, hey, you just got back from this procedure, this study. I mean, you don't call it a seminar; you call it a workshop
it's a serious
or
course.
a serious
live patient clinic,
surgical course.
Yeah.
So I just wanted the listeners to know.
Oh, I appreciate that.
Especially the ones who have been told they just can have dentures.
No,
you're out of options. Your only option is dentures. Now you come in with and with a wonderful option.
No, I listen.
To enhance their life.
It was, like I said, it was an eye-opening thing for me because it was something that I knew was possible. I didn't know how I would feel about it. It's all about the experience for the patient for me too. I felt a little uncomfortable. I said, if this is going to be really involved, maybe I do want my patient out. But after going through it and seeing how precise and smooth, I mean, you need to understand, we didn't get to this, but just so the people who are listening know, I didn't touch this patient before I planned this entire surgery on the computer.
Wow.
We're talking about, talk about accuracy here.
Right.
It was all predictable because
so this was hours of preparation.
Absolutely.
And your technical certainty because of your cone beam and your...
I mean, there are always curveballs and uncertainties in a surgery, but this minimizes them significantly. And you think about the way that we used to go in, the way I used to go in even 10 years ago, blindly. And then you get in there like, oh, boy, that's not what I was planning on. That's a scary thing for me, for the patient. That just doesn't happen very often anymore, So, yes, the planning, I'm a planner. I want things. I don't want to fail. I plan for success. I don't want my patients to suffer, and I don't want my patients to not succeed with their treatment because I fail then. And so I want to do whatever I can to set my patients up for success. And we do that. And we did that, last week, and I will continue to do that with all my procedures. And so you do not have to apologize for talking about it. I think I wasn't planning on talking about it, but it is. It's a very good topic. There's a lot of people out there that don't know this technology is possible. I've actually decided that I'm not going to give any teasers. I've got a few articles here that I think I'm gonna wait till next.
Hold off till next.
I'm gonna make people wait.
I've got to wait till next year.
It's a cliffhanger, all right? And I want you all to know that you're gonna love them. You're really gonna. I'll pull a Dr. Kanu-ism here. You're gonna really sink your teeth into these. Okay, these are gonna be some great topics. But yeah, I've got some good stuff for a future few shows here. And no, I'm glad we talked about this tonight.
All right, so I tell you what, then we've got 20 seconds.
Right.
Jeff, you're sponsoring. We're going to segue to a whole different topic.
Okay.
Another curveball, the run. I've got an email from you.
Oh, yes.
You're sponsoring a run?
We are. Yeah, the Hometown Hustle, right in downtown Rochester. All the proceeds go to the Rochester school system.
Is this a dance like...
No, we are not doing the hustle. No.
Oh, I love the hustle.
This is a 5K run or walk.
Okay.
And right through downtown Rochester, a great little track. I've been involved in it. We've been sponsors for the last several years. I'm running it. I'm hoping you're going to get in there and run it.
Can I take my wheelchair and wheel it?
You can bike it. I'll let you bike it.
But
we love to be involved in the community, as you know. And
what is the purpose of this?
All the proceeds go to right to the Rochester school system, just to help our schools right in our community.
Well, so beautiful.
It's a great cause.
I'm so happy that you do that philanthropic work.
I love it.
Well as all the traveling you do.
It's about balance, Dr. Joe. I'm still working towards the perfect balance in life. I haven't achieved it yet, but we're working hard.
Great. Well, anyways, I guess that is it for tonight's show.
I believe so.
And if any of you would like to listen to this show, you can listen on simpletruthsforhealthyliving.com or call Dr. Jeff. If you are wearing dentures, don't make me mad. Get those things out of there. There's options you have.
Or at least improve them. You can improve your own dentures.
Improve the dentures that you have.
Yeah, absolutely.
By posting them, securing them so that you can chew. And remember, digestion begins in the mouth. You need to chew, and chew again before you swallow.
Right.
And that's so important. So give Dr. Jeff a call, Rochester Advanced Dentistry, 248-656-2020. And next week, we're going to talk about...
I'm going to surprise you.
Oh, it's going to be a surprise. I've got to wait.
Cliffhanger.
All right, see you next time. Remember, in all you do, eat or drink, do all things to the glory of God. See you next time.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.